Welcome back. I'm Jennifer Cochran, and it is my pleasure as a certified lymphedema therapist, movement specialist, researcher, nationally board certified health and wellness coach, and breast cancer survivor to continue talking with you about breast cancer related lymphedema on behalf of Casting for Recovery. We've created a 3-part series for you to talk about the basics of breast cancer related lymphedema, the fact and fiction of breast cancer related lymphedema, and finally, how to approach exercise with an eye for how to make it work for your body in its post-treatment place, wherever that may be. Welcome to part 2, the fact and the fiction of breast cancer related lymphedema, and how to curiously puzzle out which is which if you're seeing new information. If this topic is completely new to you and you missed video 1, the basics, you may want to check it out now. Otherwise, let's dive in. Before we get into the fact or fiction, I want to share a bit about how to better understand information we may read in the wild and what to look for in terms of the actual research or sources these reports are coming from. It's not that different from those cues we learned in grade school when writing: who, what, when, where, why, and how. Let's start with who. Here are the who questions to ask. Who is reporting? Who provided the story? Who benefits from the reporting? Who paid for the research if it's a study finding that's being reported? And who participated? It's always important to remember the who can tell us a lot about what we might expect to see in the results. It can also give us some indicators to whether it might be biased. The reality is, in most research, the risk of bias exists. We're all human after all. When we know the who, it may alert us to other questions we may want to ask. Moving on to what. What type of study was done? Were there hundreds of randomized participants divided into comparison groups, or a case report with one case described? There are several types of studies, and the report should state the type. What data was collected? Did people answer a survey, participate in interviews, or undergo a medical exam? What analysis methods were used on the collected data? Next up is when. When it comes to medical research, the timeline of the research may be long. Something being reported today may have begun a decade or more ago. So the first question we must ask is, when did the research take place? When was an article published? And if it's older than, say, 3 to 5 years, is there new, more current data available? This brings us to where. Where did the research take place? Under what guidelines or regulations? Where can I get the source data? If you read an article that references research, it's a good place to drill down into the original research. Often the abstract is enough to give you the broad brushstrokes to answer some high-level questions, unless you're a research nerd like me and you really just want to read the whole thing. Having these answers may also help us answer the previous question of when, because often articles may be reaching back to something published in the past because a current event is making the topic relevant again. Why does it all matter? So why was the research conducted? Is there a new innovation being tested? Is it being tested against a current treatment or no treatment at all? Is it being tested against something to create a comparison group? Or is it being tested on its own? And this may be the toughest why of them all. Why do we care about the results? If some of the other answers are less than satisfactory, the answer may be that we do not actually care, because they may or may not be significant when it comes to our situation. Finally, we have the how. This is pretty straightforward. How was the study structured? How were the participants selected? Did they seek out the study? Are they healthy and volunteering to participate? Or are they at the end of their treatment options with an otherwise terminal disease? Were they paid? How were the researchers compensated and by who? This is in no way implying anything nefarious. Really, all I'm getting at here is if a pharmaceutical company is testing a new medication for a specific purpose and their own researchers are doing the research, there's an implicit bias in what they are hoping for or expecting in the results. The who, what, where, when, why, how of the thing matters. When we can consume media and print from a lens of curiosity and pure facts, we become better consumers. So hopefully that provides some research news-related food for thought. So now let's look at some research in action with 7 commonly seen breast cancer-related lymphedema statements. These are items I see quoted or referenced, sometimes within the medical community, where, depending on the age or source of the information, it may not be fully accurate. Statement 1. The risk of getting breast cancer-related lymphedema is low. Therefore, screening is unnecessary unless you have visible swelling. This is fiction. As I shared in video 1, there's some disagreement about how prevalent breast cancer-related lymphedema is. However, there's significant evidence in the research to support both preoperative, pre-treatment baseline arm measurements and regular follow-up to diagnose breast cancer-related lymphedema in early stages. In the 18 months following treatment, it's recommended to have measurements quarterly. Then you can move to annual measurements unless you become symptomatic. So if treatment for breast cancer-related lymphedema is started in early stages and managed, there is significantly less probability the condition will advance to the visible swelling stage where quality of life and ability to manage activities of daily life are impacted. It's okay to ask for this referral and insist on the screening. A study by Mass General found that when preoperative, pre-treatment measures are not taken, there is an underdiagnosis rate of approximately 50% of early stage cases. This is a strong case for baseline measurements. And it's important to note that while pre-treatment measurements are considered the appropriate standard of care, it's not yet a common practice. Statement 2. Wearing compression garments when you do not have breast cancer-related lymphedema can cause you to develop lymphedema. This is fiction. So this was thought to be true many years ago. And unfortunately, I do still encounter practitioners who still believe this. So in the past 5 years, there have been several studies conducted that show significant reduction in moderate to severe cases of lymphedema in those participants who received properly fitted compression garments and wore them for 8 to 12 hours per day for approximately 2 years during and following their treatment. One study showed that of participants in the group wearing compression, only 14% of those people went on to be treated for mild to moderate breast cancer-related lymphedema. So in the group that was not wearing compression, their comparison group, 25% of participants advanced to treatment. A second study showed rates of 16% for those wearing compression and 57% for those who were not wearing compression. So using properly fitted garments early appears to reduce long-term risk and impacts when swelling becomes more significant. So this approach also enables those preoperative baseline measures to ensure early and proper treatment if changes do occur. So in addition, longer run studies have shown many participants were able to discontinue wearing compression at the end of the 2-year period and remain lymphedema free, decreasing cost and maintaining a higher quality of life. Statement number 3. It's fine to have blood pressure checks, blood draws, IVs, or vaccinations in your affected arm because those have been found not to cause lymphedema. This is a tricky one. It does appear that this statement is technically true. However, up to 50% of breast cancer survivors who may have symptoms and subclinical or mild levels of swelling do not know they have lymphedema. And this means a blood draw could cause a skin infection, and blood pressure cuff could worsen the symptoms because they have the condition but don't know. For these reasons, it's really a best practice to avoid using the affected arm. I recently added vaccinations to this list after my own nurse at the general practitioner's office said, "Oh, I shouldn't put vaccines in the affected arm either. Why doesn't anyone teach us this?" Your lymphatic system is part of your immune system, and vaccinations impact immune function. So with COVID-19, flu shots, the shingles vaccine, tetanus shots, we're getting more vaccinations as adults than ever before. So those should go in your non-surgical arm, or for people who've had both arms impacted, the thigh muscle works as well. It's also easier to wear shorts or a long skirt where you can expose the leg than having to expose your backside, which is another area I've heard people have used. So it's normal for lymph nodes to swell following a vaccine. When there are missing lymph nodes, that normal reaction of the immune system on your surgical side could be a tipping point and cause the flow of lymph to back up, resulting in some of the symptoms that we talk about in video 1. So best practice is to take that arm off the table and advocate for yourself. Just say no. You have a whole body left to choose from. Statement number 4. Breast cancer survivors at risk for breast cancer-related lymphedema should wear compression garments when flying. This is fiction. However, it used to be fact. And as the research is expanding, we're finding that flying does not cause lymphedema. Here's where it gets tricky though. If you have any of the symptoms talked about in video 1, you should wear a properly fitted compression garment when you fly. And if your arm can predict the weather and feels achy or heavy before, during, or after a storm, that's a symptom that's not unlike what can occur when flying. So cabin pressures change at different altitudes, just like the pressures change with the fluctuation of the barometer. So the fitted part here is important. I once saw someone preparing to fly and thinking they needed compression, but who had not been fitted ask in a group if they could cut the feet off compression socks as a substitute. No, the answer is an emphatic no. Please do not do that. If you're flying really soon and you don't have proper arm garments and you do not have symptoms, you're good to go. So if you have symptoms and limited time, you could do sport sleeves. Runners often wear low-grade compression available at running or sporting goods stores, and those are at least meant for arms, and they can serve the purpose in a pinch. So best practice here is see a certified lymphedema therapist or a CLT to be measured. Compression garments are fitted by taking measurements around the arm at intervals of 4 centimeters or 10 centimeters from the wrist to the armpit. So most people without visible swelling can wear off-the-shelf compression garments. If your measurements fall outside of the ranges for off-the-shelf, you may need custom garments made specifically for your measurements. However, this is not common at very early stages or for prevention purposes. Statement number 5, avoid repetitive motion with the affected arm. This is fiction. So we're going to talk about exercise more in depth in video 3. This is a common item that I see about repetitive motion. Please remember, everything in moderation. Also, I want to acknowledge that depending on the motion, repetitive motions can be an issue for a healthy joint that has never gone through a surgery or treatment of any kind. So that said, when it comes to recovering from breast cancer surgeries, slow and steady increases in movement and weight being lifted wins the race. So I encourage you to experiment with things you enjoy. For instance, dragon boat racing is a repetitive movement, yet there are teams of breast cancer survivors who love dragon boat racing and find it to be really helpful. Pickleball is another sport that's relatively low impact and uses those arms in really good ways. One of my favorites is kayaking. I was pleasantly shocked by how beneficial kayaking is for me, as well as a friend who has a fairly significant case of breast cancer-related lymphedema. We come off the water and our arms are looking fabulous. That is a very repetitive activity, but it is also a tremendously beneficial one. So more on this topic during video 3, but the takeaway here is listen to your body, take it slow, and try different movements to see what works best for you. Statement number 6. It's been 10 years since my surgery or active treatment, so I cannot get lymphedema now. Fiction. This is pretty straightforward. There have been cases of people being diagnosed 20 years after treatment. Precautions and risk-reducing behaviors like those from video 1 should be followed for the rest of your life. This is a condition that comes with a lifetime risk. So please share that with anyone who does not know. Remember, this is a condition that we do not talk enough about. Self-advocacy is tremendously important. Statement number 7. Compression garments only need to be replaced annually. Fiction. I am always a little surprised that as patients, we're not better educated by the providers prescribing compression garments for lymphedema. So here's a little show and tell. These are some of my arm sleeves, and I replace them on average every 6 months. For a more severe condition, 3 months may be more appropriate. So every 6 months, I order 3 sleeves, and I rotate them so that they can be laundered and regain their shape for the next time I wear it. So if you're wearing the same sleeve every day and not washing it in between, the compression level on Monday is not going to have the same level of effectiveness on Friday. You also may not make it 3 months if you're only wearing 1 sleeve every day. It's going to stretch out much faster. So these are stretchy and they lose their compression over time. So you may be able to see here that these are slightly different colors. We've got this one here is darker, then a little bit lighter in the middle, and a little bit lighter on the end. So when I lay them one over the next, they also get smaller with each one. And it may be a little hard to see here, but you can see how if I press this down, there's the lighter colored one sticking out from behind the new one, which is much smaller. So this one here on top is brand new. So I saved it to illustrate this point. So you can see here at the top how this is much larger than this part down here. It kind of gaps there at the top. And then that gets wider as time goes on. So this is the difference between a sleeve that I've had for a year and a brand new sleeve. And it's a pretty significant difference. And you're going to feel that difference in how it feels on your arm. So it's true that compression garments are expensive. So purchasing 3 at a time and multiple times per year can be a significant cost. The Lymphedema Treatment Act was finally passed at the end of 2022. And this means compression garments for all people with a diagnosis of lymphedema will be covered under Medicare. So once this is fully fleshed out, insurance should change how they process and cover compression garments for all people with lymphedema. This should make ordering garments easier and hopefully less expensive. However, it's still going to take several years for those coverages to take full effect. So in 2023, Medicare is mapping out the details of what compression garment coverage will look like. So if you want to catch up on where this process is, you can check out the link here, lymphedematreatmentact.org/aboutthebill/current status. So this is great news for all lymphedema patients. The fact that this has not been covered until now may have contributed to insurance denying coverage for breast cancer-related lymphedema in the past. Now, the Women's Health and Cancer Rights Act of 1998 requires insurers to cover compression garments by law for breast cancer survivors who develop breast cancer-related lymphedema as a result of treatment for breast cancer. This is a coverage that is provided by law. So if you have insurance and coverage of garments is denied, please call your insurance company and ask to speak with a supervisor to explain that coverage is required by law under the 1998 Women's Health and Cancer Act. I actually learned this from a United Healthcare supervisor who was very bothered that their provider had canceled my order when the coverage was improperly denied by an automated process. So it can be a bit onerous and time-consuming, but it can also mean the difference between a sleeve that costs $130 out of pocket or one that costs $13 or $26 because you only owe 10 or 20% coinsurance. So ultimately, getting sleeves and wearing them regularly can save money and improve your overall quality of life. That was a lot of fiction supported by the current facts from the research as it exists at the time of this recording. So it's exciting, the advances that we're making in this area. This brings us to the end of breast cancer-related lymphedema fact or fiction. If you missed it, you can check out video 1 where I cover breast cancer-related lymphedema basics, what it is, risk factors, symptoms, and how to mitigate your risks. Next up is video 3. Exercise, getting and staying moving. Thanks for watching, and if you have questions, feel free to reach out with any questions that you may have. I'm happy to help you out.